You have an amazing center there, which I hope everyone in the room already knows about, but I'm going to mention a few of the highlights that touch on some of the key areas of healing that I'm going to review today. So I'm going to share my slides in just a minute, but first I wanted to thank everyone at the University of Cincinnati Medical School, Integrative Center. What you are doing right now is very similar to what my center at Scripps and dozens of other high-level academic institutions around the country are doing, because they realize that integrative medicine is really the future of healthcare. And it is really just so inspiring to see folks on a Saturday showing up to do yoga, eat healthy food, and create a community that truly understands that and hopefully takes that message out to the larger community. And so with that, I'm going to share my slides to talk about how this can fit into the paradigm of healing pain. So as we talk about transforming pain, we have to realize that what we are doing right now for pain in a conventional sense, not at your integrative center, but how it's done in a traditional, conventional way at most places around the country is not optimal. And that's been the case for many, many years, and it's caused more problems than really help folks who are trying to heal. And we know that on their own, many folks are trying various therapies, and what really helps those transform to a better quality of life is how they coordinate with other folks and their healthcare providers. So I'm going to talk about the importance of coordination and really the importance of care. You know, when I talk about healthcare, I almost have a hard time saying those words together. And I've been at Scripps now more than 20 years as director of pain management, and before that, as a family physician. That unfortunately, our healthcare system is really not about health and wellness as much as it is as a fix-it system. Sort of, when things go wrong, let's fix it. And in many cases, that's what's needed. But we're talking about chronic illness, chronic conditions like pain. We need to take a different approach. And I think in many cases, our current approach takes out the health and wellness aspect of it. And in doing so, also gets rid of the most important aspect, the most important C, as I'll mention. There's going to be a number of C's that I'll key in on why we are at this stage of pain management. One of the key missing pieces of that is the lack of care when we are trying to help those in pain, whether it's with our loved ones or in the medical system. So where does that leave us? It leaves us with a lack of care. And before I can go into some of the key therapies, I want to take a moment with the group here in the audience. And this is something I like to do before many of my talks, is to ask, how are you taking care of yourself? And we know all the laundry list of things we could be doing, and some we do wonderfully. We might be a great eater or exerciser or mind-body person, but there are often areas that are difficult or maybe dark areas that we don't feel fully able to create wellness. So just for a few minutes today, before we get into the actual topic, I want to make you the topic and say, to ask yourself, how can I better take care of myself? And at Scripps, we often use the SMART analogy, which is picking a goal that is specific, measurable, attainable, but somewhat challenging, but attainable, relevant to your future needs and areas that are priorities in your life and family. And it's timely, something that's not going to be 10 years from now, but within a month or two. Pick one area that for yourself doesn't get the amount of care that you really believe it deserves. And we all know what that might be, whatever comes to mind. And I want you to say to yourself, this can be a mental note, it can be a note on your phone, whatever helps you. How do I promise to instill care into my health in the next month? And it shouldn't be a difficult question. Something should just kind of bubble up. And just to give you a few examples, start walking at lunch. I will make an appointment with a mental health professional, which is something that many of us had challenges with and have had the need to go there but haven't. Set up that preventative test that's been a little bit delayed. I will check my blood pressure and go in and see my doctor, which I've also delayed. I will eat one meal mindfully per day. I will pause and do nothing for 10 minutes a day, which for many of us is the most difficult thing that we can imagine, just doing nothing and sitting with our thoughts. So whatever that is, I'm going to just be quiet for about 30 seconds and just have you solidify that however you want to, mentally, or make a sentence or two note on your phone, or write it down on your napkin. Just think about that. And I'm going to challenge you one more step. And if you're comfortable, this is completely voluntary, I want you to take your step, your vow, your promise, and I want you to email it to the people at the University of Cincinnati Integrative Center. This is a special email that will go to their staff, and in 1 month, approximately, they will check in with you and say, how's it going? How's it going, Pat or Jim or other members in the crowd? If you're willing, please send it. It's no obligation. They're there to support you, and you have the fortune to have an integrated staff who are adept at lifestyle management. So if there's an area you want to have them hold you accountable, please take a moment and just email that now or anytime this morning. So with that, I wanted to transition to our actual topic, which is the same, the care of those with pain. In order to understand how we can best care for that, I like to spend a little bit of time of talking about why we're in the situation. What is the state of pain and the treatment of pain in America? I want to talk about what therapy does students, and again, how to instill, re-infuse care into our care management system, pain management system. You'll hear me talk about a lot of different terms. We use integrative medicine or integrative health. In many cases, you hear other terms like non-pharmacological care, complementary care, holistic care. In many cases, I see them as things that optimize care. So although I'll use integrative medicine most of the time, the goal of this is not to discount what you're already doing those blood pressure checks and yearly visits and all the bread and butter things you need to special attention. And that's really what integrative medicine does. It takes evidence-based integrative therapies and tries to optimize conventional care. And why is that important in pain? Because we are not doing a good job in pain management. As somebody who's been director of pain management at a center for over 20 years, I see the deficits, and I sit on my hospital's pain management committee, the opioid stewardship committee, and I see that over the last several decades, the number of Americans has jumped dramatically who are suffering from pain, up to about 180 million plus. And that is about 40% of our population, probably going to be close to 50% of our population soon. And that is at a time, just to put it in perspective, that we've had the most powerful medicines, narcotics, procedures, surgery. So it's not about not having the right tools. In America, we have, we're fortunate to have the right tools at the right time for acute pain. What happens is when we're using those for chronic pain, we get into trouble. So that can also be a very costly endeavor when we try to fix it, when we try to cure a chronic issue that is really not curable. We can create the most expensive endeavor in medicine, which is pain, that crosses over multiple other endeavors. So you might have pain related to heart issues, diabetes, etc. And we spend over $600 billion per year. Part of it is the mentality. It's a great article that's called Overtreating Chronic Back Pain. Time to back off by doing more procedures and medications, etc., which again have their place in certain aspects, especially early chapters of pain, but not typically in the later chapters. We still continue to use them. And we have a healthcare system that promotes that. Again, not at centers that are doing more integrative care, but at most conventional centers, this is how it's done. And our expenditures and overdoing does not get us any return on investment. And I'll show you two graphs. This is disability, looking at musculoskeletal issues versus other areas like heart problems, lung problems. And somehow musculoskeletal issues have not been able to be managed in a chronic, sort of comprehensive way. More recent data shows the same thing, the purple being musculoskeletal issues off the charts, where we can manage other types of pain, other types of conditions. We have not been able to do that with chronic pain, and part of that is how we approach it. It's a fix-it, cure-it mentality. That has also had catastrophic. So we talked about costly. Now we're going to talk about catastrophic, the other C, and that has, as many of you know, and I'm going to spend a lot of time on this, transitioned us to big problems with now synthetic opioids, which was previously prescription opioids. So this is a problem that many of our communities are dealing with, the catastrophe. The next C is really the complexity of this. We know that when somebody comes in to see us, or any clinician with chronic pain, it's not just chronic pain, it's really a matter of insomnia and fatigue and depression. In fact, in a VA study, the veterans study, the average person with chronic pain has 6 other conditions that would also need management. And in this study, they said, if only there was a clinical care model that could appreciate simultaneously this complexity and approach it in a way that might help that would be awesome. What they were really describing is integrative medicine and the need to approach it in a nuanced way that really appreciates all the needs of that patient beyond just the pain. And I think patients already understand that. We know that patients already go to complementary care at high numbers, and the vast majority see some levels of benefit. The problem is that many times it's fragmented. They're not telling the doctor more than half the time. The doctor may not be asking, again, not in integrative centers where that is our job, and we're trying to coordinate and create community, but in many cases this is fragmented around the country. And although good treatments are done, they are often in isolation from the rest of the team. So we'll talk about the importance of that as we approach these therapies. And the evidence shows that when we are able to coordinate these therapies, conventional care, good therapies, conventionally with medications, plus therapies like acupuncture, biofeedback, etc., we definitely have better effects on the pain, reducing the pain and its disability, improving function. We also know that it improves cost. We know that on an outpatient, if you're going to a clinic like there in Cincinnati, getting integrative therapies with a team, it overall reduces costs long term. We also know in the hospital, with some elegant studies, that patients who receive integrative care while they are getting their hospital care not only reduce their pain and anxiety a significant amount, but there's also hundreds of dollars that are saved during a hospitalization, typically because less medications are needed for insomnia and anxiety. Patients have less complications, go home earlier when they are able to derive benefits from integrative medicine. So if we are having therapies that are beneficial and are cost-saving, which ones should we pursue? Which one should be at the top of our list? And that's what I'm going to spend a few minutes on next to talk about what we really need to consider. So as part of the consortium, the academic consortium for integrative health and medicine, which Dr. Cotton is now one of the recent board members elected to that, chosen for that. It's an incredible honor to have her as part of that. We were able to put together several years ago, I was one of the authors that scoured the research to say what is really going to be most effective of these therapies, acupuncture all the way down to all the other therapies that we're going to talk about. And we have the evidence. But what I want to boil it down to is that many of these areas come down to a fundamental awareness of what's happening with mind, body, and spirit. What's happening with the breath, what's happening with the muscles. That we often see in pain patients is fragmented. A pain patient, as you can imagine, doesn't want to be near an area of pain. So there's a lot of detachment that integrative medicine, through various therapies that are listed here, are going to reintroduce in a gentle, compassionate way. How can we re-enter the body and the mind, not as our enemy, but as our friend? And I like to start with the most fundamental tool, which is just breath. And you think, breath, that's just something that happens naturally, and how can it affect pain? Well, we know that as pain initiates and progresses, about 75% of patients with chronic pain actually have dysfunctional breathing, typically shallow breathing. Many of the yoga therapists, the biofeedback therapists, the practitioners know that already, but it's not something that's appreciated. So when I see a pain patient, one of the most immediate things I do is try to appreciate their breathing. Not just the rate of breathing, although that can be elevated, but how they're breathing. Maybe holding it, not able to really get it into the lower parts of their abdomen. And in studies where we just train patients to breathe better versus traditional conventional approaches where they might get physical therapy, breathing actually does as well, if not better. Why? Because it brings back that awareness of the body in a gentle way, and that patient is allowed to go in there knowing that this is part of the solution, to reintroduce what was natural before it became dysfunction. So I think breath retraining is so important. I like to spend a few minutes over the next few breaths just taking a deep breath in, you're putting your hand on your stomach, and then breathing out. trying to do an extended breath. Now let's do it one more time. Exhale fully. And breathe in 2, 3, 4, 5. Hold it, pause, and then slowly let it go. And one last time, just on your own, whatever pace makes sense to you. A nice deep breath in, counting to 4 or 5. And then an exhale that's a little bit deeper than the inhale. And just exhaling that out. Just by doing that, just by allowing more breath into the lower parts of your lungs, stretching your diaphragm, you are allowing so many beneficial things that we often ignore. Improved circulation, decreased muscle tension. In some studies, significantly decreased pain within a few minutes if you have awareness of that breath and are able to extend the benefit of that breath to the rest of your body. So many benefits that we start with. So breath training is so important in our clinic, as it is in yours. We also do progressive muscle relaxation, which is basically taking a breath, and as you're doing the extended diaphragmatic deep breath, go into a muscle that might be tight, whether it's your shoulders, low back, and letting those areas decrease in tension. Also allows pain to go down if you do this for 5 to 10 minutes a day, not a big ask. So those 10 minutes that might have been your goal, where you're doing nothing, just focus on the breath and try to clear your mind as best you can. It has been shown to reduce pain and stress within a month. So very fundamental. If you need additional support, biofeedback is an excellent tool where a trained professional will sit with you and you are able to see in real time on a computer screen and with other sensors how those techniques, the deep breathing, the awareness, is able to shift your body in real time. And what is amazing is that as we do biofeedback in our clinic, which is one of our primary interventions, we see a significant decrease within 3 or 4 weeks of anxiety and depression and chronic pain, headache. The most important aspect of this is really self-advocacy, which is the person with pain understands that I have some control over it. Even at the level of my breath and movement and how I see my muscles, I am able to control my pain, even a little bit, and over time, that can have such a significant benefit. So the key point here is that integrative therapies really help to approach pain at a foundational level of awareness of the breath and body. What about other areas? What about areas where we combine movement with breath? And I'm a big fan of Tai Chi and yoga, but Tai Chi I trained in when I did the Richter Fellowship. As Dr. Cotton mentioned, it's something that I do every single day as best I can. This morning, as I was thinking about this presentation and trying to get settled for it, Tai Chi was one of my tools. And one of the reasons that we see benefit with Tai Chi is that it allows gentle movement, which actually in parts of the world, such as in certain parts of Asia, is actually part of cardiac rehab. So it does give you exercise. It builds lower body muscles. It does increase your heart rate, even though it's very gentle, because you are challenging your body in doing motions that you may not think about, just like breathing, in a very mindful way. And you're challenging your balance, putting all your weight on one leg, then the other. And I think it's an incredible combination of taking that breath and body awareness and putting it into those challenging and gentle movements. This is a picture up top here. I'm on the upper left where I'm teaching a group of doctors how to do Tai Chi. For some of them, the very first time they've had this body awareness in this particular way. And we know that beyond just improving muscle strength, balance, muscle awareness, it has significant ability for the brain and improving mood. We also know it has significant ability to improve balance, and there's a number of studies in chronic pain management in the setting of arthritis. So something, if you haven't done it, please give it a shot. Yoga is another mindful movement exercise. In this case, in many cases, we're not transitioning our body as we're standing, but we're doing it in a seated way using different positions, which then can also significantly increase upper body strength, slightly different in Tai Chi. What it also does is that breathing has been shown in yogic research to significantly alter our nervous system, to go from sort of a stress predominant to a relaxation predominant system. We also know that it can help with digestion and metabolism. We know that it can increase, as I said, upper body strength, flexibility by over a third. Even in patients who have no flexibility that they think of, yoga can be incredible. Again, something to consider. One of the best things I like about yoga, which is a misconception, is that you need to be adept. You need to have Lululemon pants to be able to be adept at yoga. And one of my colleagues and friends, Rob Saper, took yoga to a non-English speaking, low-income community and taught them these basic stretches. And he really didn't, bother with all the background of yoga and just taught them the stretches. And it was the basement of the family practice clinic and had significant improvement in patients that never heard of or done yoga in reducing their pain, reducing their medication requirement, and overall improvement in quality of life. So a lot of the areas that we think about these therapies and who they're good for and who they're not is really all about being open to it. And I think it can be really helpful to have mindful movement, to reintroduce movement in a non-painful, gentle manner, being compassionate with our body as we gently move it into new ways. I do want to talk a little bit about acupuncture, which is also a technique we use a lot in our clinic. And when we use acupuncture, we think of, okay, that needle is going into a tight muscle. And yes, it's going to help that tight muscle because we have endorphins being released. But we also note significant improvement in our heart rate, in our blood pressure, and changes in our hormonal system, where cortisol, adrenaline, and some of the stress chemicals go away, and beneficial chemicals, oxytocin, dopamine, serotonin can actually be bolstered. So acupuncture works in many different arenas, not just in endorphins, which is important for pain management, but it can really help our system be more adept at whatever challenges come about. And we know that evidence is very strong that acupuncture, especially for headaches, low back pain, and arthritis pain is important. And with many of the therapies I mentioned, I do want to emphasize the importance of that these are slow medicine. Typically, one acupuncture treatment, one Tai Chi session is not going to cure anything. And again, we're not going towards cure. How can we gently bring care back into the body and mind? So we need an accumulative sort of filling the tank with these therapies and their beneficial changes and shifts that they create. So it's not one therapy session, it's usually 8 to 12 that I suggest. And sometimes patients get benefit sooner, and sometimes it takes longer. I was very glad to hear that Medicare last year began to cover acupuncture, and we are beginning to do that in our center for initially low back pain. Acupuncture is covered for 12 sessions initially, and if it has benefit, an additional 8 to maintain that benefit. So we're seeing it increasingly covered by various insurances. In some cases, it's still not covered, but very worth the benefit that it has for overall health and care. We also know that it can help in post-surgical pain management to reduce opioids, improve functionality immediately after a procedure, because again, it helps with the stress management being reduced in a very stressful environment. The key points with acupuncture, the benefits go beyond endorphins. We know it can be helpful in acute and chronic pain. It may also help to reduce medication requirements in some cases. Massage and manual therapy, I just want to make the point that it's often seen as sort of as a spa therapy. Can it really be a pain management therapy? And in well-done studies, the answer is absolutely yes. Although we may conceptualize it as something not medical, it can be very beneficial for chronic pain. In fact, they did a study in primary care clinics where they randomized patients to 12 weeks of acupuncture and found that there was a 50% reduction in pain, which maintained after massages were discontinued for another 3 months. And what was really wonderful to hear about this was that older patients who you would think might have less benefit or have more disability actually benefited more from the massage. In many cases because the muscles really improve at a higher level with improved circulation and range of motion. It's important to find somebody who is adept at chronic pain treatment, maybe somebody that's adept at acupressure or myofascial release if you're interested in trying this. And again, you need an cumulative number of treatments. So I want to transition to a topic that you are incorporating right now. And hopefully you're not incorporating like this picture. Hopefully it's the opposite of this picture. But we do know that diet and exercise is a significant factor in chronic pain. At least at our clinic, we try to educate patients who many times are on what's called the standard American diet, also known as SAD. The acronym is SAD, because most Americans are not eating enough fruits and vegetables. Just as one example, less than 10% are getting the recommended amount. And there are many things that happen with that. Less fiber intake, which causes an increased inflammation, lower magnesium levels, all the things that go on to cause increased pain. And that inflammation can then cause other deficiencies, which cause increased pain. And that pain can cause a change not only in activity, but it can actually change our food choices. So it's this vicious cycle that we often try to interact with and try to shift. We do know that small changes, just taking that one fruit and vegetable serving per day and taking closer to 5 or 6, can have a significant reduction, can promote a significant reduction in arthritic pain in a number of studies. And we also know that patients with fibromyalgia will often have very painful muscles, decreased function, a lot of fatigue. That polyphenol-rich foods, polyphenols are the active ingredients that come from those deep, rich colors in fruits and vegetables that are actually medicines for our muscles and our joints and our body, have been shown to also reduce pain in the setting of fibromyalgia. In the setting of headache, when we increase omega-3s, things that come from healthy seafood and other omegas, can be significantly helpful in reducing headaches, because omegas encapsulate our neurons and our neurological cellular matrix. So if we do not have enough of that in our diet, and instead we're eating very poor inflammatory fats from deep fried foods, etc., we're going to have the opposite effect. But if we increase it, as this UCLA study did, significant 30% or more reduction in need for medications for headache. So I want to give one quick example and then a study on this. And that quick example is a patient, my patient Blythe, who agreed to share her story. She was part of our lifestyle program several years ago. And so she had low back pain, which required surgery, which unfortunately did not give her a cure. She had lifelong issues with weight and diabetes. And over time also developed fibromyalgia. And what we decided, and was immobilized, and this is her visiting Disneyland with her mom. And over time, we decided that we need to have kind of a full court press with diet and exercise. And so this is her baseline, 280 pounds, high insulin, high blood sugars. And over about 4 months, she was able to shave a total of 22 pounds. What was important is she was able to add muscle. So she actually lost more body fat, but it was able to preserve and keep more muscle, which I think is a key component and often a missing piece of what happens in the typical diet of most Americans. So it's really important to work with a team, especially a good personal trainer, dietitian who's really going to make sure that you don't lose muscle as you're trying to lose weight. Her insulin normalized, her diabetes went into regression. And what we see most importantly is, as part of that, she was able to become functional. She was able to get back into her exercise routine. This is actually the gym that we have downstairs from my clinic, which we're very fortunate to have. So we can make diet and exercise real medicine for patients, not something they do somewhere else, but something that we really believe in. And the evidence is not just for Blythe. This is an 18-month study of several hundred patients that showed that just a 5% weight loss caused over a 30% improvement in pain and function. So it doesn't take a lot. It's that initiative, the momentum that's created by trying to be more active, trying to eat a better and healthier diet, that in many cases reduces the inflammation that can create the pain management. And we know that a healthy diet also improves our sleep quality. We know that when we have a healthy, like Mediterranean type diet, reduce the unhealthy fats, bring in healthy fats, it not only improves our pain and our heart health, but it also improves insomnia, our quality of life, our depression. So there's many therapies that the point here are interconnected. One will help the other, and so on, in multiple areas that might need help in the setting of chronic pain, which is, as we talked about, more than just pain. So diet and exercise have a very strong synergistic benefit to food and activity being medicine. So finally, what is the role of care? In the next few minutes, I wanted to mention that as we talked about the C's of health care, specifically in chronic pain, that are problematic, the complexity of it, the catastrophic nature, the costliness of it. One of the areas that I think is a real solution to that is really instilling care, both self-care and the care we give to others as providers in the setting of chronic disease. And how do you do that best? It really is the inner work. It's not about an injection I do. It's not necessarily even about the acupuncture needle that I give to a patient as part of their treatment. It's about what's happening internally with mindfulness, gratitude, compassion, which often are difficult to come back to, especially if you are hating, as a pain patient, what you are, your moment-to-moment existence. But it is something that is teachable. It's something, especially as a community, as a group, that we can support each other. So I want to talk a few minutes about that. Mindfulness, many of you are familiar with this. It is available at your integrative center, but it is really awareness without judgment. In many cases, again, if you're having chronic low back pain, it's hard not to judge. It's hard to not think about the next fun activity you're going to miss or the things that brought you there. But having self-compassion, non-judgmental self-compassion is so important and something that we spend a lot of time on. And it's not something, again, that happens in 1 minute, but over 8 weeks in a mindfulness-based stress reduction course, the MBSR, can be a profound, beneficial treatment. If you have not had that experience with or without pain, it's an incredible class, and I would also suggest it to your loved ones who are dealing with pain or anxiety or stress. We know that when we do mindfulness-based stress reduction, this is the orange line, it outdoes traditional cognitive behavioral therapy in a 1-year study and usual care. Obviously, the benefits need to be sustained, need to continue. In a follow-up study, they began to wane. So we need to continue to be mindful as much as we can day to day, even after formal training. The reason is that mindfulness helps with that rumination, those distressful thoughts that often come in everyday life, but if you are in pain, those come more steadily, and you need a salve. You need a medicine to help mentally neutralize those, and mindfulness is part of that. We also know that the benefits of meditation happen within that 8-week course in changing the actual function, and in some cases, the structure of the brain. And that's hard to believe. Many of us think you have to be a monk who meditates on a mountain for 20 years to see any meaningful changes and to find out real serenity. We know that within 8 weeks, in some studies even within 4 weeks, there are significant brain changes which parallel those seen in long-time experienced meditators. And what if you combine that with gratitude? There are a number of studies which show that as you are doing the mindfulness and compassion exercise, if you can instill gratitude, just think of 3 things you are grateful for every evening before you go to bed, either mentally or journaling, whatever it works for you, has had a significant ability in studies of pain patients to reduce their anxiety, interference of pain, fear of movement, and their efficacy dealing with that next pain flare. So we're not talking about a therapy that's done in the clinic. We're not talking about a costly intervention. We're simply asking about being grateful for the small things that happen within our day, in spite of the things that may have not been the best things. Can you find 3 nuggets of hope in your day? And also finding compassion. This is actually a loving kindness practice that involves mindfulness, also has been shown to be pain. And one of the quotes of the participants was that all these things don't take the pain away, but they do help you accept it and cope with it. And that's the real key here. We're not trying to cure. We're trying to gently support our day-to-day or moment-to-moment experience. And that in and of itself can be sort of the aha moment that allows the person that is dealing with pain to begin to see relief, to begin to see hope. One of the best ways to do all these therapies, compassion, mindfulness, gratitude work, is within a group setting. I know you have a wonderful developed program of group health, group medical visits, and they're so important for the educational piece, how to go shopping, how to cook, how to interact in difficult, stressful situations. And in some cases, actually getting the therapies, like acupuncture or progressive muscle relaxation within a group, which can be very conducive. That group energy is very difficult to describe, but has profound benefits. And in fact, I think this is the key slide for my entire presentation, is that when we think about chronic pain in a research setting, which I often do in clinical trials all the time, is we look at it as a number. And we've been trained to look at it as a number. Is your pain less than what started? So was it 8, now is it 6? Wonderful, we succeeded. Well, that's a very unfortunate way to look at it. It's a very simplistic, unidimensional way. And when we actually look behind the curtain, when patients are using integrative therapies, what they actually get is much more profound levels of healing. Increased options are noted, increased hope, ability to become aware of the body, relax it, real, true ability to cope and improve in the moment when we are stressed and in situations that might provoke pain. That is what these therapies are really doing. They might still improve the pain, and that's great, but we're learning after many, many decades of mistakes that how we should really look at pain is not through a number, but through function and hope and care. So these therapies, again, can cause a deeper, unanticipated level of healing, which again can be difficult to determine if we are using simplistic measures. So often I ask patients, how has that shifted your outlook? How has that helped your coping? How has this helped your function? What else can we do to improve care and function as you're trying to reduce your pain? Those are often questions that we didn't ask 10 years ago about pain. And I think we need to do that more. So to close up this discussion, I think one of the key things that we often realize is that those of us in our communities that are living with pain are often doing the best that we can, whether it's through yoga, mindfulness, trying to eat a better diet. And in many cases, it is fragmented. So if I were to say one thing to folks who are dealing with pain or caregivers of those is appreciate the complexity. Don't run away from the complexity. Your depression, your fatigue, your change in diet, those are all connected to pain. In many cases, those have to be approached in a very gentle, compassionate manner, using integrative therapies, as I would promote as the best way to go into a complex situation is using a complex framework, things like acupuncture, things like yoga, things like biofeedback, with a full dose of compassion, a full dose of gratitude, which is often lost in our typical medical environment. So as we approach this and we think about what is the best therapy, I want to return back to the question I asked at the beginning, which is how will you care for yourself to a greater degree in the next month? Will it be drinking more green tea, taking a Tai Chi class, trying acupuncture for a series of sessions, trying manual therapy, massage therapy, maybe creating greater community, joining a club, pushing your limits to areas where you don't typically where you don't search for your health. But those are typically the areas where often the care is waiting for those who are dealing with pain or any chronic issue. And even if we're not, those can sometimes be part of the healing, the prevention. That in many parts of the world, as I study, these are done not when things go off the tracks, but done to keep us on the track, to prevent the need for them. So I would say one of the key things that we want to look at here is how we can bring back care. We know that the treatment of chronic pain is often focused on the cure, and that can cause very costly, catastrophic scenarios. The focus that infuses greater care through these integrative therapies that we've mentioned, which are available to you, as well as self-care approaches, and especially reflection, expression, in those dark places, in those places where often we try to distance, which in many cases are the areas that need the most care, are really the way we can transform and bring health and care back into how Americans with pain live day to day. So I appreciate your attention today. I hope some of this has been helpful. I want to remind you of the amazing resources you have at University of Cincinnati Integrative Health Center. The phone number is here. That email that will help keep you accountable if you choose to use it is there. Or if you simply want to reach out and say, how can I begin to do some of these classes that Dr. B mentioned, that would be a great start. And I wish you much luck finding health and healing for yourself, your family, and your loved ones. Thank you so much.